Hello, my name is Dr. Diwan S. Raja. Today I will discuss about Klinefelter syndrome. So what is the definition of Klinefelter syndrome? This is male hypogonadism that occurs when there are two X chromosomes and one Y chromosome. Okay, we got the definition of Klinefelter syndrome. We may have more than two X chromosomes and we have one Y chromosome. Okay, so this is one of the most common cause of male hypogonadism. Okay, it is one of the most common causes of genetic disease of sex chromosome. Incidence is 1 in 660 male. Okay, male have the Klinefelter syndrome. Okay, this is not diagnosed before puberty. It is diagnosed at puberty and most commonly in the fertility clinic because most of them are sterile. Okay, so diagnosed after puberty and in the fertility clinic. Okay, we got that. So it is a disease of the chromosome. It is a genetic disorder. So what is the karyotype of Klinefelter syndrome? Okay, we'll go to the karyotype. That is the chromosomal constitution of an individual. Okay, most common karyotype is 47XXY. This is the most common in 90% cases. Okay, we have other type of karyotype like that of 48XXXY, even 49XXXXY, that is possible. We may have mosaic, that means it is 46XY and we get 47XXY. So these are the possible karyotype, but this is most common, and we know that if we have two X chromosome, we have one bar body. Okay, here we'll get one bar body, Here we'll get two bar body, Here we'll get three bar body. Okay, so we know that part. Klinefelter syndrome, the patient is phenotypically a male person in 46XY should not have any body. Okay, so we got the karyotype. This is the most common type. These are also possible. Mosaic is possible, and most of them are sterile except the mosaics. Okay, so most of the Klinefelter syndrome patients are sterile. Okay, except on very rare occasion. In case of mosaics, we have two series of cells. One series is normal, another series with Klinefelters, 46XY/46XXY. In that condition, fertility may be possible. Okay, but it is with a lot of possibility even not getting fertility. Okay, so we got that. We got the karyotype. What is the cause of Klinefelter syndrome? Why this karyotype? Okay, why this happened? Why we have 47XXY? What is the reason for one additional X chromosome? This is due to non-disjunction of the first meiotic division in the mother or in the father's cells, in the father's cell. Okay, father cell means that spermatozoa or ovum. We have meiosis in the spermatozoa and ovum. So especially in the first meiotic division, there may be non-disjunction. So it is a non-disjunction, the first meiotic division of the mother or in the father. Okay, whatever may be the reason, so if it is from the non-disjunction of the father or the mother, but the phenotype will be defective. Okay, so there is no distinct difference between the phenotype due to the maternal meiotic fault or the paternal meiotic fault. Okay, we'll get this type of non-disjunction of the either in the oogenesis or spermatogenesis of oogenesis or spermatogenesis. Okay, so that is the cause of one additional X chromosome and one barbody. Okay, we got that. Okay, now we'll go to the physical findings. We can call it signs and symptoms. Okay, signs and symptoms. Okay, so if you look at that picture, what we'll see, most common condition, they're tall individuals, and that their height is disproportionate. The height from the sole to the symphysis pubis, this height would be more than that of the height of the crown to the pubis. So this part is longer than that of this part. So lower part of the body is longer. You can say that, call it lower part of the body is longer. So from the sole to pubis height, the height from the sole to the pubis is more than from crown to the pubis. Okay, so they are tall, disproportionate tall, and body is elongated. Body is elongated. Okay, less masculine. Okay, lack of secondary sexual characteristics. Lack of secondary sexual characteristics. Characteristics. Okay. So we'll get that. So what happened? So body here. So here, if you look at the head, will not get any type of frontal bossing is absent. No frontal bossing, male type frontal bossing is absent. Okay, so that is not present here. Voice is not deep. Is not deep. Okay. Beard will not grow, maybe less grow. Beard and mustache. Okay, and mustache less developed. Also, pubic hair may not develop properly. Okay, we get that. So tall, disproportionately tall, lower part of the body is taller than that of the upper part of the body. Okay, and not masculine body, and secondary sexual characteristic of a male like beard, mustache, and deepening of the voice would not be present. Okay, so looks like an eunuch. Looks like an eunuch. Eunuchoid. Eunuchoid body. Okay, looks like an eunuch. That means the person without testes. Okay, so most important feature is that small testes. How much small? Very small testes. Okay, this is small. It is less than 2 centimeter in any way, height, length, width, everything less than 2 centimeter. We can call less than 10 ml. Okay, and testes will be hard feeling testes. Hard feeling testes. Okay, it is hard feeling, and we'll get the testes, and also small pains. Okay, so we got that. Then we must find out around 40% cases, even more, will get enlarged breast in the male. We call it gynecomastia. That means enlarged breast in the male individual. We call it gynecomastia. Okay, testes are ectopic, small. Lack of secondary sexual characteristic, lack of deep voice, beard, mustache, Okay, gynecomastia. Okay, we got that. And body is not masculine as we discussed. Okay. Tall individual, but muscles are not well developed, not well built. Okay, we got that. Then we'll get regarding this person's IQ. IQ may be normal. Okay, may be normal or less than the siblings. Okay, may be normal or less than other siblings. Okay, siblings of this patient. So it may be normal, but it may be less than normal in most cases, less than other siblings. Okay, usually not mentally retarded, not mentally retarded, not mentally retarded. Okay, that is usually. Okay, so usually not mentally retarded. Okay, so you got that. Maybe low IQ, but not mentally retarded. Okay, we got that. Then why these findings happen to this person with Klinefelter syndrome? Why we are getting gynecomastia, disproportionate height, tall individual, less masculine, small testes and small penis. Okay, lack of body hair and sexual characteristic, lack of deep voice. What is the reason behind it? Okay, we have two reasons. We can go through that part. Okay, so idea is that some of the, okay, we call the pathogenesis. Pathogenesis. Okay, what happens? Okay, some of the genes in the X chromosome escapes inactivation is one of the causes. Some of the genes in the X chromosome, especially in the short arm of the X chromosome, escape inactivation. Okay, this is one. Another possibility, the reason for that, defective gene encoding the androgen receptors. Defective gene encoding for the androgen receptors. Androgen receptors. Androgen, here is the testosterone. Okay. So possible cause of this physical finding in a patient of Klinefelter syndrome. We have karyotype, certainly we have karyotype. Then if you go, what is the, why this type of phenotype, we'll get some of the genes in the X chromosome, especially in the short arm of the X chromosome, escape inactivation. So some of the X chromosome remains that will cause these phenotypical changes in the male individual. He is phenotypically male because he has a Y chromosome. Defective gene encoding for the androgen receptors, so it is found that there will be lack of free testosterone, and also if the testosterone, total testosterone even normal, but manifestation will not be good because of defective gene encoding for the androgen receptors. Okay, we got that. Now we go to the associated diseases with the Klinefelter syndrome. Okay, what are the associated diseases with Klinefelter syndrome? Associated diseases. Okay, so we may have type 2 diabetes, type 2 diabetes, insulin resistance, metabolic syndrome. Okay, this is associated with that of Klinefelter syndrome, and this Klinefelter syndrome has gynecomastia. They have 20 times more chance to get breast cancer than that of a normal male individual. Okay, so we'll get the possibility, increased tendency or increased possibility of getting breast cancer. Okay, that is a possibility. Then we must know that this Klinefelter syndrome, around 50% cases may have mitral valve prolapse. Mitral valve prolapse. Okay, around 50% cases of Klinefelter syndrome, and certainly gynecomastia, that is enlarged breast. Okay, we got that. They have increased tendency to have osteoporosis, increased tendency to have increased possibility of osteoporosis. Okay, so we got that. So these are the associated finding, and certainly there are some chances of getting cancers. Okay, other cancer other than breast cancer, we may have non-gonadal germ cell cancer is a possibility that is associated with Klinefelter syndrome in some cases. Okay, we may get that non-gonadal germ cell cancer. Okay, so we got that. So, and we got that insulin resistance, metabolic syndrome, possibility of breast cancer. Okay, so we got diabetes, metabolic syndrome, insulin resistance, mitral valve prolapse, and increased chance to get osteoporosis. Okay, higher risk of breast cancer, extragonadal germ cell cancer is also possible. Okay, plus we have to add, we have more chance to get autoimmune diseases, more chance to get autoimmune diseases, autoimmune diseases. Okay. Like systemic lupus erythematosus, like SLE, even bronchial asthma, more possible in a person with Klinefelter syndrome. They may be fatigue, may feel tiredness because they are not very masculine. Okay, that is a possibility also. So chance of getting autoimmune disease like systemic lupus erythematosus is common there. Okay. So we got the associated diseases with Klinefelter syndrome. Now we'll go to the lab workup or laboratory diagnosis. Lab workup. Okay. In this patient with Klinefelter syndrome, usually testosterone is less. Testosterone is low. Okay. They have high estradiol. Estradiol is high. Okay. They have high follicle stimulating hormone. Follicle stimulating hormone is high. Testosterone, if it is normal, but we have to remember that the free testosterone is low, always low. Total testosterone may be low, may be normal, but free testosterone is always low. So we got that, the lab findings. Okay, we got that. Now we have to find out the testicular biopsy report. Testicular biopsy. What we'll get in the testis? If we get the testis here, okay, this is the testis. We have the testicular lobules, and that lobule contains seminiferous tubules. Seminiferous tubules. Okay. What we'll get in the testis? Hyalinization of the seminiferous tubule, seminiferous tubules. Okay, and it may be atrophied. Okay, the may be totally atrophied. The seminiferous tubule may be atrophied totally. Atrophied totally. Okay, or partially. The Leydig cell may be prominent, but its function is not normal. Interstitial cell of Leydig will give emphasis on hyalinization of the seminiferous tubule. On palpation, it is hard feeling. Okay, its size is very small. It's around 2 centimeter, maybe 10 ml. Okay, that is the finding in testicular biopsy. Okay, we got that. Now we'll go to the management of a patient of Klinefelter syndrome. Management. Okay. It could be managed by testosterone, but it should be started very soon in mid-adolescence period. So testosterone should be started from mid-adolescence period onwards. Okay. So testosterone will help to develop secondary sexual characteristic. Okay, that is very important. and testosterone is essential to develop secondary sexual characteristics. Okay, plus to prevent osteoporosis, okay, to prevent osteoporosis, and also psychological well-being, to build, okay, to build psychological well-being. Okay, we got that. So testosterone has some role in the management, a significant role, and also what we like to do, we also there's a management is testosterone plus mastectomy. So to remove the large breast, okay, surgically, that will help to prevent the future breast cancer, also some type of psychological well-being. Okay, so that's all about Klinefelter syndrome. So if you like my video, please support my channel, please subscribe me, and please share the information with your friends. If you have any question, please feel free to ask me. Have a nice day. Bye now.